In strong opposition to House Resolution 382 and urge my colleagues to support my motion to recommit, which would prohibit this legislation from going into effect as it will negatively impact Medicare beneficiaries. Speaker McCarthy has publicly stated that cuts to Medicare will be off the table in any debt ceiling negotiations, but that commitment clearly does not carry over to today's legislation. House Resolution 382 would increase patient costs and cut hospital payments to Medicare beneficiaries. In its nearly 68 years of existence, Medicare has given millions of Americans access to affordable health care coverage. Generations have been given peace of mind knowing that they'll have comprehensive available coverage to them of any age, regardless of the financial status. In 2021, nearly 64 million Americans, including 4.8 million Floridians, were enrolled in Medicare. These individuals are Democrats, Republicans, and everything in between. They're our friends, our family members, our colleagues, our neighbors, our mentors. We must ensure that these beneficiaries can continue to rely on the life-saving coverage provided through Medicare. The President has announced his intention to end the public health emergency on May 11th, providing a glide path to smoothly transition out of the emergency era programs. As Florida's former Director of Emergency Management during the early days of the pandemic, I helped stand up many of the public health emergency initiatives that provided Americans with COVID-19 tests, treatments, and vaccines at no charge. These initiatives offered enhanced social safety net benefits to help the nation cope with the pandemic and minimize the impact. What would an instant cut to this social safety net mean for Medicare beneficiaries and their families? The American family could face an abrupt increase in costs and decrease in care. What would this mean for your local hospital back home? Hospitals could see a cut of 20% for care of COVID patients without a responsible plan in place. Millions of patients, including many veterans, children, would abruptly face increased barriers to critical hospital care. Rural patients and those with behavioral health needs would be among the most impacted. So why are some of my colleagues pushing for this to happen? Because it's rooted in political messaging, not thoughtful policy. An instant termination to the public health emergency without proper coordination with agencies, states, and providers would interrupt insurance coverage, access to care, increase patients' out-of-pocket costs, and threaten provider payments. I, like many of my Democratic colleagues and millions of Americans.
Good morning, friends. Happy Saturday to all of you. Yes, friends, it is true. Lawmakers have just announced big news. Inflation relief is on the way for the American people. New legislation is being worked on by the Biden administration to help low-income households and seniors financially. If you meet the eligibility requirements, you may be eligible for a one-time stimulus direct deposit from your state. So friends, please do me a big favor and watch until the end of this video to hear about all of these details. Also, at the end of today's video, I will be announcing 2 winners from yesterday's Walmart gift card giveaway. If you'd like to enter the giveaway, friends, please make sure that you are subscribed to my channel, click and like several of my videos, and then comment below the keyword of each video that you watch. The more videos that you watch and then leave a comment on, the greater your chances, friends, of winning the weekly giveaways. There are millions of retirees and senior citizens that are continuing to have trouble making ends meet. Democrats may not control the House of Representatives anymore, but many lawmakers are trying to pass new relief legislation. Congressman Mark Pocan is not giving up on his legislative agenda to help older adults. Pocan, a Wisconsin Democrat and the former co-chair of the Congressional Progressive Caucus, is instead focusing on playing the long game of policy making. Representative Mark Pocan's commitment to promoting progressive policies will be on display as he reintroduces the Save Medicare Act. It is a key provision in the Inflation Reduction Act that allows Medicare to negotiate prices on the costliest prescriptions each year. It will likely save the United States billions of dollars. Beginning in 2026, Medicare will begin negotiating the price of 10 prescriptions that cost the federal government the most money, followed by 15 more prescriptions in 2027. Researchers estimated how much money the new policy would have saved the United States had it been in effect from 2018 to 2020. Those are the most recent years for which data is available on Medicare spending. The Centers for Medicaid and Medicaid Services said earlier this month it is still working on its plan for how exactly it will implement negotiations with drug manufacturers. It plans to release a list of the first 10 prescriptions that will target for prescription pricing negotiation by September of this year. Nationally and in every state, the minimum cost of living for older adults, calculated by the Elder Index, far exceeds federal poverty thresholds, which are used to calculate official poverty statistics. The Elder Index estimates that a single older adult paying rent needs about $27,000 to pay for basic expenses in 2021. So for couples, the gap between the index calculation of necessities and the poverty threshold was even greater. Yet eligibility for Medicaid, food stamps, housing assistance, and other safety net programs that help older adults is based on federal poverty standards, which do not account for variations in the cost of living or even medical expenses that are incurred by older adults. University of Massachusetts researchers have showed that Social Security benefits cover only a fraction of what older adults need for basic living expenses. So friends, do you agree with this or not? Please let me know what your thoughts are in the comment section below. A massive tax break plan has been agreed upon in the state of Michigan, and it looks to be on the way to residents of Michigan. Governor Gretchen Whitmer announced an agreement was recently reached between her and Democratic leaders. It will bring major relief to seniors and working families specifically, but also line the pockets of every taxpayer. Much of the debate in the first month of the legislature has been around this tax relief plan, including who is going to get it and how much they will receive. The plan is agreed upon and now just has to be voted on. But the framework of a massive tax relief plan coming to residents of Michigan will include the repeal of the state retirement tax, impacting 500,000 homes, expanding the earned income tax credit, which will also affect 700,000 homes. Also, it is mentioned for the very first time a direct check to every taxpayer in the state of Michigan. Governor Gretchen Whitmer said, "It is not known what impact this will have on the income tax rollback the Republicans have been pushing to protect. But the rebate checks deliver immediate relief for every resident of Michigan, which the GOP has wanted." Immediate reaction was mixed from the other side, with House Minority Leader Matt Hall. Matt Hall said, "We are sitting on a $9 billion surplus. Michigan families do not have to choose between immediate relief and a permanent income tax cut." This latest scheme, crafted behind closed doors, appears to be the governor's newest attempt to cancel the income tax cut that's due to every Michigan resident this year and every year afterward. And my most beautiful and amazing friends, that is the end of my daily stimulus update video for this Saturday morning. Thank you, friends, for joining me here and being part of this community. The two winners of yesterday's Walmart gift card giveaway of $75 is Kathy McClarty and D. Hunter. Congratulations, my friends! To claim your gift card, please check your notifications page and send me a message. Or you can also message me on my Facebook page. Friends, please make sure that you enter the next giveaway simply by clicking and liking several of my videos. The more videos that you watch and then comment on, the greater your chances, my friends, of winning the weekly giveaways.